Hello and welcome to this video on the social determinants of health. This is a crucial concept to grasp, as it significantly affects both individual and population health. In this video, we'll explore what social determinants are, how they influence health, and a helpful framework for understanding them. Take a moment to observe the people around you, your family, friends, and community. One thing becomes evident. Health differs not only among individuals, but also across different groups. Let's consider an example. In 2015, a child born in Sierra Leone had an average life expectancy of 50 years, while in Australia, it was 83 years, a striking difference of 33 years. Disparities like this exist even within the same country. In Australia, for instance, the life expectancy of Indigenous Australians is about 10 years shorter than that of non-Indigenous Australians. Within any population, health is closely tied to social standing. People who have higher incomes, better education, and more secure jobs generally enjoy better health and tend to live longer. Health status isn't fixed either. It can change. Studies on migrants show that health conditions, behaviors, and risk factors often differ from those in their countries of origin. So, why do we see such wide variations in health? To answer that, we need to understand the factors that shape health. These are known as health determinants. A person's health is shaped by various influences. These include personal characteristics, like age, sex, and genetics, as well as lifestyle choices, such as smoking, physical activity, diet, and alcohol consumption. However, health is also profoundly affected by the environments people are born into, grow up in, live, work, and age. These environments encompass social and community relationships, cultural, economic, and environmental conditions, and the healthcare systems available to them. Collectively, these are referred to as the social determinants of health. These determinants are deeply rooted in how money, power, and resources are distributed at the global, national, and local levels. They play a significant role in shaping health inequalities, that is, unfair and preventable differences in health outcomes among different populations. There are many social determinants of health operating across multiple levels and interacting in complex ways. To explain how these factors affect health and well-being, several models or frameworks have been developed. Let's take a look at one such framework, created by the World Health Organization. This framework divides health determinants into two major categories: structural determinants, intermediary determinants. Structural determinants refer to the wider socio-economic and political context in which a person is born and lives. These include the ways societies are governed, economic and social policies, public policy, and the cultural and social values placed on health. These factors influence the unequal distribution of material and financial resources, which shapes a person's socioeconomic position. Socioeconomic position defines someone's role or status in society and affects their exposure to health risks and their ability to recover from illness. It is determined by several factors, including education, job status, income, gender, ethnicity, and social class. This position, in turn, influences the intermediary determinants of health, which include material conditions, such as housing quality, access to nutritious food, clothing, and other essentials for healthy living, workplace environment, psychosocial factors like stress, relationships, and social support, behavioral and biological factors. Additionally, health systems themselves influence health outcomes. The accessibility, affordability, and quality of healthcare services significantly affect how well people can maintain their health. Social cohesion and social capital serve as bridges between structural and intermediary determinants. They describe how willing individuals within a community are to support one another and work together for the common good. It's important to recognize that the relationships among these determinants are not always linear. They are often complex and bidirectional. For instance, Low income and poor education can lead to worse health outcomes, but poor health can also hinder educational attainment and job prospects. Similarly, widespread illness in a population can influence the broader social and political environment. So how can we address these health determinants? Improving social determinants of health is challenging. It requires identifying both the structural and intermediary factors and taking coordinated action to improve them. This calls for efforts across all areas of society, local, national, and international, and at all levels. Actions must be tailored to each context, considering existing political, economic, and social conditions, available resources, and the will to make changes. And that brings us to the end of this brief overview of social determinants of health. We've discussed what they are, how they influence health, and a framework for better understanding them.